Well, they've been talking about it for 7 years, and today was the day. Republicans finally announcing their plan to replace Obamacare. We'll take a look at what's in it, what's not, and whether it'll ever get the votes needed to pass. Then our conversation with Congressman Jim Himes of Connecticut. The Intelligence Committee member is here with the very latest on President Trump's claims that the president actually had Obama wiretapped. Also, while speaking to his employees at HUD, the new secretary, Ben Carson, says slaves dragged here from Africa were actually immigrants with dreams of success for their families. I cannot make this up here, but it may not be the weirdest thing that's just happened in the Trump administration. Evening, everybody, and welcome to RFL. I'm Richard French. As usual lately, a busy day in Washington, and it has been the Republican rallying cry for 7+ years now: repeal and replace. I'm talking, of course, about Obamacare. And now, years later, we are finally seeing what that GOP replacement might actually look like. But the Republican plan, finally revealed last night, has already generated a whole lot of complaints, questions, and pushbacks. And I'm not even talking about from the Democrats. There are real concerns that there won't be enough Republican votes to get this thing passed. First, the details, what we know, what we don't, and for more, let's bring in our senior political correspondent, Andrew Whitman.
And Rich, as you hinted at, there are still more questions than answers about the GOP health care plan, or as some have taken to calling it, Trump care. But one thing we do know for sure, if it passes, this bill will dramatically change the way everything works when it comes to health care for everyone in this nation. The Republican promise to repeal and replace.
I am also calling on this Congress to repeal and replace Obamacare.
1 week after President Trump's call to Congress, House Republicans outlined their plan to overhaul Obamacare. Their plan ends subsidies for tax credits to help Americans buy insurance, ends penalties for Americans without insurance, and gradually ends the expansion of Medicaid, which provides coverage for more than 10 million Americans in 31 states. The plan also ends funding for Planned Parenthood, but the White House is offering to keep funding the group if the organization stops offering abortion services.
After years of Obamacare's broken promises, we're proud to put forth a plan that represents a better way for patients and for American families.
The plan keeps two of the most popular ACA provisions. Coverage still can't be denied based on pre-existing conditions, and young adults can stay on their parents' plan until they're 26. But Republican Jason Chaffetz on CNN making waves with his comment, seeming to acknowledge the plan will shift more of the financial burden to Americans.
Americans have choices, and they've got to make a choice. And so maybe rather than getting that new iPhone that they just love and they want to go spend hundreds of dollars on that, maybe they should invest it in their own health care.
And that iPhone comment got lots of pushback. Now, that is the plan in its most basic form, but we wanted to drill down on some of the finer points of the proposal. And number one is what's causing the most questions and confusion. The plan has not been scored by the Congressional Budget Office, or CBO. That's an independent bipartisan research team that reviews bills and determines how much they might cost and the impact of the policies. Republicans have skipped this part so far, meaning no one knows what the plan will cost, what the financial impact would be on the insured, or perhaps most importantly, how many Americans will lose health care coverage because of it. And we may not get those answers until well into this process, perhaps even after the House and or the Senate actually vote on the bill. But most independent analysts who monitor healthcare policy are estimating somewhere in the ballpark of 15 to 20 million people will lose their health insurance under this plan. Then there are some specific changes to what would be covered and how that coverage would actually work. In addition to removing the individual mandate, Trump Care would also kill the employer mandate on health insurance. That means companies with 50 or more employees would no longer be required to provide health insurance, and that could leave some people uninsured, others paying for their own coverage, and likely paying more for that same coverage. There would also be a penalty for lapsed coverage. So if you go 3 months without getting covered and then you try to sign up again, you would pay a penalty, which would likely discourage more people from actually buying health insurance. Trump Care would also change your health care costs. It estimates, or eliminates rather, the subsidies that help millions pay for health insurance, replacing those subsidies with tax credits based on a person's age and not their income. Trump Care would also dramatically change and perhaps eventually kill the expansion of Medicaid. The plan scales back Medicaid payments from the federal government to states, and it would base payments on the number of people enrolled and not on the actual health care costs that states incur under the program. Seniors would almost certainly pay more for their health care coverage under Trump Care. The bill raises the maximum that seniors can pay for their premiums from 3 times the cost of the cheapest insurance under Obamacare to 5 times the cheapest plan under Trump Care. And Trump Care would also threaten the availability of a woman's right to abortion access. In addition to blocking all funding for Planned Parenthood, the bill blocks the use of any tax credits for any insurance plan that also covers abortion. That means fewer plans would be likely to include abortion, and it would foster a real concern that insurers might just drop abortion coverage altogether. That could have a huge impact for women, especially on the lower end of the economic ladder. So that's the policy, or at least part of it. What about the politics? Well, first up, for President Trump himself, does the Trump Care plan match what the president has promised? Here he is early on in the primary campaign.
Everybody's got to be covered. This is an un-Republican thing for me to say, because a lot of times they say, no, the lower 25%, they can't afford private. But
universal health care.
I am going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of, much better than they're taken care of now.
The uninsured person is going to be taken care of.
They're going to be taken care of.
And the then president-elect went even further in an interview he gave in January, saying, quote, "We're going to have insurance for everybody. There was a philosophy in some circles that if you can't pay for it, you don't get it. That's not going to happen with us." And he added that people covered under the law can expect to have great health care. It will be in a much simplified form, much less expensive, and much better. Except that, once again, initial estimates are between 15 and 20 million people will lose their health insurance. That is a far cry from Trump's statement that it is insurance for everybody. And we've already detailed how many, if not most, people's insurance and health care costs will go up under Trump Care. That's not exactly Trump keeping his promises on this one. The other political question to ask tonight is, can this Trump Care plan even pass through Congress? Amazingly, after 7+ years of calls to repeal and replace, the odds tonight look for it to be against passing, at least in its current form. Democrats are the easiest group to peg. They are against Trump Care, all of them, at least from the Democrats that we've heard from so far. Which means Republicans need majorities in both houses to get this thing to the president's desk, and they may not have the votes. Purple district and state Republicans in both houses, those who scored narrow election wins or they're in states or districts that could go either way in the next election, they're already on record worrying that the bill goes too far, especially in states that have expanded Medicaid. They worry that the bill will shortchange their states and leave taxpayers holding the bag. In fact, 4 Republican senators are already against the plan, enough to block its passage in the Senate. But Republicans also have their problems on the right. Conservative Freedom or Tea Party caucus Republicans don't think the bill erases enough of Obamacare. They're saying Trump Care is chock full of mandates, taxes, and entitlements, and they've taken to calling the bill Obamacare Light. One final note on the Trump Care proposal, the timeline for what happens next. Remember these complaints after Obamacare was first proposed in 2009? Chance of read the bill. Turns out now Republicans have a read the bill problem of their own. The bill was released yesterday. Beforehand, only Republican committee members were allowed to view it. But the first House votes on this bill are scheduled tomorrow. And Mitch McConnell has said he will not even allow the bill to go through Senate committees. He wants an up or down vote on whatever comes out of the House. So after 7 years of delaying an alternative to Obamacare, Republicans are now trying to push Trump Care through and do it in a hurry, Rich, before they go home to meet their district in April.
So much to unpack here, Andrew. Great job. Thank you. Let me bring in our panel. Dominic Carter, political journalist and author. Scott Vanderhoff, former 5-term Republican Rockland County exec and co-chairman of the Palisades Institute at Dominican College. And you met Andrew already. Scott, I start with you. If you're a Republican right now, and of different levels of government, but let's say you're a Republican governor and you're one of these states with expanded Medicaid. Talk about, between now and next November, what you're worried could happen here from both the math and the optics, where people can see and feel what could change.
It's enormous. I mean, it is as big a shift as the original Obamacare Act was. And let me just say, this is not going to pass this way. I mean, I think you did a great job, but this isn't going to be the end result. You got too many flack people on the sides, conservatives, Democrats who are not going to let it go through, even though Trump seems to support it. But your question is really interesting, because the Medicaid piece of this, it's like a little piece in there.
Yep.
That's enormous. For New York State, that means incredible, I am certain, incredible amount of loss of money, because we had the Cadillac of Medicaid programs here where we pay for the costs of the individuals. You qualify. Medicaid money is paid. Under this plan, Medicaid would only pay per person a certain amount. You have an allotment, which would be an enormous change. And for all those states who bought into Obamacare, many because of the Medicaid reimbursement, because remember, Medicaid became the cauldron where a lot of these folks ended up being insured, it's going to be a big hit. So a lot of governors are looking at this going, it won't work. Coming back then to the politics of it, now you're looking at 2018 and exactly how people are going to run on this thing based on losing money for the states, based on the confusion, based on potentially losing all these currently insured individuals. So it's fraught with lots of problems. Even though many of us say it's great that they don't mandate these things any longer, this is no easy solution.
Especially when you're going to unwind something. It's one thing of its philosophy, but it's reality. And Dominic, that brings me to the human portion of it. You know, I remember if we go back 7+ years ago when this was all talked about, it took a while for people to see any tangible benefit. And then even when that happened, it was marketed so crummily that you didn't know what it was. And we always make a joke at this table. If you ask how many people what they think of Obamacare, it's pretty split. But if you call it the Affordable Care Act, 2/3 of the people like the thing. So this is different, though. If they all of a sudden say, take this thing into the wastebasket of history, we're going to start all over again. And Andrew's numbers are even close to being right. 15 to 20 million people that have it, they're going to lose it. Let alone, I didn't see prescription drug costs coming way down for some of the seniors. I didn't see here a whole lot of these programs are going to be impacted. Cutting off, if they want to cut off altogether, Planned Parenthood, if they don't make that concession, people forget what Planned Parenthood does. You know, it's not just abortions. I get the feeling, and tell me if you disagree, people are going to feel this and see this, and for the first time on this issue say, what the hell did we sign up for?
I agree with you. I concur with your point. I don't understand, Richard, frankly, how Republicans could even put forth in the House could put forth a plan like this. The county exec is correct, and I want you, because if you think Republicans have trouble now with their town hall meetings, where do you see what will happen as they go into their midterm election? This is a recipe for total disaster. What do I mean by that? Whenever you hear the term that what basically amounts to, and this is what the county exec was just alluding to, when you hear something that basically amounts to a block grant, that means that, and we're talking Medicaid dollars, that means essentially what we're talking about here is limited dollars. Now, of course, no government can go on and on providing services in terms of taxpayer dollars. But Richard, we're talking about when you cut Medicaid dollars to the degree, we're talking about people that you're going to feel this impact almost immediately, and it's going to be alarming, and it's going, I think you're going to see a country.
Let's put it in our terms, Dominic. In TV terms, they're easy stories to tell. All of a sudden, somebody shows their bill and says, I used to pay this, now I pay this. How am I going to I have to make the difference between prescriptions and the grocery bills. And Andrew, for me, what's stunning is what you hit on. They've had 7 years. And day one out of the gates, I saw dueling press conferences where I saw the moderates saying, are you crazy? I'm not signing up for this. The Susan Collinses of the world and the other Republican senators said, no way. And then I saw 20 guys lining up one after the other to get in front of the microphone to say, this is Obama light. It doesn't go far enough. It seems that they never got, as you say, you got to count the votes here. They also never got people in a room and said, this is what we're going to do. And you know what? We're going to get along to go along here if you want to do something. Politically, Democrats, all they have to do, and maybe for once they can actually do this, is shut up.
Yeah, I don't think there's a whole lot of hope that among Republicans that Democrats were going to step in and provide the votes that they need for this. But they didn't, it wasn't just that they weren't able to get every Republican on the same page. We've talked about the split in the Republican Party for quite some time, and that's what's underlying all of this. That there are members on the hard right who simply cannot sell this because it doesn't go far enough, and it isn't a straight repeal. Rand Paul today was calling for just forget about the replace. Let's just do a straight repeal and we'll pick it up from there. And you do have these purple state Republicans whose states have already, gone in for the Medicaid expansion, and they're saying this is absolutely going to handcuff our state if this gets through. There are too many changes going on here. So it's the dynamic of the Republican Party that's the problem. Just one last note about all of this. This bill was not, in my view, designed to improve the quality of health care for anybody in the United States. The bill was designed to do two things. It was designed to reverse the less palatable parts of Obamacare, particularly for Republicans. Things like those mandates that they don't particularly like and they think are unconstitutional. It's also designed to cripple the remains of Obamacare, to make sure that the systems that are set in place don't function. So that as we get those stories that you were talking about over the next couple of years about people's premiums being higher, Republicans can turn to that and say, that's not us, that's Obamacare. That's the failure of Obamacare that we've been talking about for all this time.
Except
they basically undermine the foundation to make sure it collapses.
Except I'd say to that, in day one out of the gates, Senator Chaffetz is one of the more prominent voices, and I would argue in some cases more astute voices that are coming. He said today, and you're going to hear it 1,000 times, maybe people shouldn't buy their iPhone if they want health care. That's in the nub of it what was said. Now, Andrew also played the clips. Trump told everybody, and you got the sound bites that we're going to hear. You're going to see those clips from 60 Minutes. Trust me, everybody. If you're sick of it now, get ready to turn the channel, because not just on this program, but everyone are going to play him saying nobody's going to lose their health care. It's going to be better. It's going to be cheaper. All three, Scott, aren't true. Now, everybody might think he's a BS artist, but this was a biggie.
It was, and it is. And the other day when he said almost under his breath, this is far more complicated than yeah, it always has been. And partially because when it was proposed, it was complicated. Nobody really even knew. I mean, I remember Obama saying there's no tax in here. There is a tax in there. I mean, it really caught people off guard.
Not everyone's going to keep their doctor and all those things. People overpromise. But as he said, and he was right, the minute we repeal this thing, we own it as Republicans. That was Donald Trump who said it. And you know what? The commander-in-chief was 100% on the money. Where this goes from here, your guess, as they say, as good as ours. All right, coming up next. White House is now refusing to even comment on those wiretapping allegations made by, I don't know, President Trump about his predecessor. Now, some top Republicans are saying, let's see the proof. Well, today, Dominic spoke to Congressman Jim Himes. He sits on the Intelligence Committee. He's got a lot to say about that.